So, thank you for this podium. I am going to present the management and the guidelines of the type 1 diabetes. Hello, I am Dr. Shubhra Bhattacharya, MBBS from the Medical College Kolkata and former junior resident from the AIIMS Scotland in the General Medicine, non-academic. And I want to say, we all know by my fellow, some friends and some seniors and some juniors, that type 1 diabetes mellitus is an autoimmune disorder, and approximately 95,000 cases reported in the type 1 diabetes mellitus in the India in 2022. And the first and utmost necessary thing is the investigation according to the management. And as per the ADA and the EASD, there is the investigation flowchart which we have to follow for the management. And the utmost necessary step of the management is the glycemic control. And this is the glycemic. So, and utmost necessary thing is the glycemic control, and this is the glycemic goal as per the ADA and the EASD, and the ICMR give that glycemic goal for the management of the diabetes type 1. For the therapy, when we start for the diabetes management, then we have to start for the glucose monitoring, start the insulin therapy, prepare for the hypoglycemia and the hyperglycemia both. And most important thing is the diabetes self-management education and the support system, which is the necessary step as per the ADA and the EASD. For the insulin therapy, there are some multiple daily injections, long-acting insulin analogs, rapid and the ultra-rapid acting insulins, and there are some regimens used in the India, but the hybrid cross-loop technology and the insulin pump is the new bulging topic of the type 1 diabetes mellitus management. This is the insulin therapy in the this is the insulin therapies and the type of insulin present in our era, and we know the insulin therapy is 0.2 into 0.6 unit. We have to multiple that and that number to the weight of the person, and the 50% is used as the basal bolus and the rest is as the rapid. And when we start for the beta cell replacement therapy, the 40% as the basal and the rest is as the rapid. The beta cell replacement therapy is present, and ADA and the EASD told us in case of chronic kidney disease and the metabolic complication, the beta cell replacement therapy should be used or can be used. And the most important thing as per the ICMR, this is the diabetic type 1 meal chart which should be used in case of management of the meal. And in case of exercise, that is very good, but we have to mention and we have to look if there is any kind of cardiovascular morbidities or any kind of NPDR or PDR, the vigorous exercise is contraindicated in that patients. Now coming to the complication and that management, like hypoglycemia should be managed by the use of the glucose tablets, fruits and juice. In case of hyperglycemia and the diabetic ketoacidosis, the education of the patient and right, that is most important, like the sugar charting and the sugar maintaining. The cardiovascular complications, nephropathy, neuropathy should be eliminated by the measuring of the blood sugar, blood pressure and the cholesterol level also. AC inhibitors and the ARB should be added in case of nephropathy. Now coming to the retinopathy and the food complications, that should be early detected by the visiting the immediate to the doctors. Type 1 diabetes mellitus and the pregnancy, the ICMR told us the preconception counseling, HbA1c level, TSH level and the folic acid should be implemented in the type 1 diabetes with the pregnancy. And there is the flowchart and there is the protocols of the ADA and the EASD for the type 1 with the pregnancy. For the travel, we have to know, we have to bring the glucose meter, lancet, batteries and the other thing if there is a type 1 diabetes mellitus patient is going to travel. Now come to some up-to-dates. VX880 by the Harvard Stem Cell University or Institute give that, and it is the phase 1 or phase 2 trial which is used for the along with the immunosuppressive therapy. ZH2 inhibitors like JSK126 and the tazemetostat is mainly stimulate the beta cell for producing of the insulin. For the cell encapsulation, we have to go for the implementation for the insulin, amylin and the glucagon, which is act as a artificial or the bionic pancreas. For the immunotherapy, the T cell targeting therapies are there, and for the pancreatic transplantation along with the kidney transplantation is already done in the India. The continuous glucose monitoring machine is there for measuring the glucose. The artificial pancreas is mainly useful in the full night time. For the smart contact lenses is useful for the glucose sensing, and the glucose sensing tattoos is there, which sends the nanoparticles of the glucose of the blood level, and that is used. And the smart apps will be there in the market, in the Play Store, which can give us the glucose track and the medications. And I want to say the medical team, the glucose monitoring, insulin therapy, meal planning, stress management and physical activity, along with the patient education and support, along with the lifestyle modification, one diabetes type 1 mellitus can be managed. This is my references, and I am very much thankful to NCESA and Medical College Bengal to give me this platform. Thank you so much.